So fertility and pregnancy is the next topic that we will discuss today as a continuation of the Endo series. So as I mentioned in the earlier series, when would you seek advice and how does endometriosis affect your life? When it affects your fertility, it can be really hard to know whether you actually have endometriosis or not, and often women who suffer from the fertility side of endometriosis don't necessarily have the painful periods, so they can be surprised when they're finally diagnosed with endometriosis, because you don't always get pain when you have endometriosis. You can simply have infertility as the only symptom that you get. As I mentioned earlier, the way that endometriosis affects fertility, and I'll go through that in a bit more detail now. Endometriosis is an inflammatory condition, so it can make the environment hostile for sperm and might make the sperm, it might affect the sperm in a way that the sperm can't fertilise the eggs. Endometriosis can affect the eggs themselves, and as I mentioned in other series, the eggs, particularly when they're on the ovary or next to an endometrioma, can be affected by having a poorer quality. And we know that because when we do IVF on women who have endometriosis, we tend to get poorer fertilizations and poorer embryo development compared to women who don't have endometriosis. It can also affect fertility by causing the adhesions that I mentioned earlier. And when the adhesions become quite severe, they can actually block the fallopian tubes, or they can cause a thing called hydrosalpinx, where the fallopian tube ends are affected and the fallopian tubes are filled then with fluid, and this fluid affects the ability of the embryo to implant even with IVF. And there are probably many other ways that that fertility is affected, such as affecting the lining of the womb and making that lining hostile for the early embryo implanting. And it's probably actually a multifactorial way that endometriosis affects fertility. But for the most part, we can treat this. So we know in studies which were done more than 20 years ago, which were randomized control studies, where we randomized women who have endometriosis into surgery, where one group of women had removal of the endometriosis and the other group of women who were known to have endometriosis had no surgery. The women who had surgery and resection of their endometriosis had a doubling of their pregnancy chance compared to the other group of patients. And that was shown in 2 studies. I've also been part of a publication looking at long-term fertility outcomes for endometriosis, and we know that if you have surgery once in your life for endometriosis, it still means that you will have a higher fertility rate than someone who hasn't had surgery and has endometriosis, even up to 5 years after that initial surgery, which is a new finding that we found in our study, because those earlier studies that I referred to really only looked at 6 to 12 months following that initial surgery. So surgery really can help with endometriosis. And it helps by boosting your spontaneous chance of getting pregnant. So if you're not keen on undergoing IVF or other assisted reproduction, then doing surgery, removing endometriosis, is a very good treatment, particularly if a woman is young and has endometriosis, because when you are young, you're unlikely to have some of the other factors that can cause infertility, such as poor egg quality. When a woman is a bit older, so over 35 or particularly over 38, then we know that time really isn't on your side. So if you are over 35 or 38 particularly, surgery and plus or minus adding IVF is probably the way to go. The way that IVF works is it boosts your chances per month of pregnancy. So in any 1 month, when you're trying naturally, you essentially have 1 or at most 2 chances, because you only ovulate a single egg with every month. And so if that egg doesn't fertilize with the sperm and it doesn't implant, you have to wait for a whole, another 30 days or 28 days until you ovulate again. So it takes a long, long time to get pregnant, because you're sort of playing a sort of Russian roulette of which month it's going to be, and that's how the time is extended for getting pregnant. In IVF, we recruit a number of eggs per any one cycle, so we might get anywhere between 5 and 15 eggs, and so you're essentially getting 15 chances of pregnancy per month, and that's one of the main ways that IVF improves your chance of pregnancy. We then take out those eggs and we put the sperm with the eggs and fertilise them outside of the body and grow out those embryos up to day 5. During that time, when we see these early embryos, we see a number of them do not make it through to day 5. Once we get to day 5, those embryos have got a 30 to 50% chance of being a live baby, and we put it back within the same month. So it basically concentrates 4 or 5 months of trying into 1 month. IVF is also a treatment for endometriosis, but it's not necessarily the only treatment for you. And that's why I say that it really depends on the woman and her situation. It depends on how many eggs she has, how old she is, as to what type of treatment you may suggest for that woman with endometriosis. It also depends on the woman's goals and the couple's goals and how they feel about things like IVF, because not everyone wants to do IVF, and therefore doing surgery might be a better option so they can keep trying naturally. And not everyone wants to undergo surgery, which is obviously invasive, and some women choose to do an IVF cycle instead to improve their fertility. Once you are pregnant, we try to take very good care of you and support that early embryo. However, we think that the pregnancy should proceed on just like any other pregnancy. And pregnancy is actually a fantastic thing for endometriosis, because during pregnancy, your body naturally produces high doses of progesterone, which is a hormone that I mentioned in my last session on adolescence, which is a treatment of endometriosis, and that suppresses those endometriotic deposits in the lining of the womb. So being pregnant is a treatment for endometriosis. And when you are pregnant, it gives your body 9 months reprieve from those multiple cycles that feed endometriosis, and you're also treating those endometriotic deposits. And you should go along with your pregnancy absolutely normally. And we do find with women who get pregnant after having endometriosis surgery or not getting pregnant the first time, they're able to get pregnant quite quickly afterwards, probably because they've had their own treatment by getting pregnant. So I definitely think that if you're thinking about getting pregnant and you know that you have endometriosis, you should get onto it earlier and not wait till it's too late, because as you get older, you have the additive effect of advancing maternal age and the effect that that has on the eggs, even without endometriosis. And I find seeing lots and lots of women with endometriosis, they may have got pregnant easily earlier in life, in their 20s for instance, and then perhaps come to see me when they have a new partner in their late 30s. They know they have endometriosis, they got pregnant easily the first time when they were in their late 20s, but suddenly they can't get pregnant. And it's that additive effect of the advancing maternal age, the effect that that has on a woman on top of the endometriosis, that makes that really hard for the woman to get pregnant. I hope that this session has been useful for you. I'd love to hear more about your comments or any questions that you may have. You can find me at Wallara Health and Beauty through Facebook, or feel free to email me or send me a message via Instagram.
Perfect, yeah.
All right.
Yeah,
Okay.
that was really good. That was a great one.
All right, good.
Yeah.
Yeah, stuff that you don't often hear about, is it, like about the pregnancy and
Yeah.
Okay. Should I do a final one on research?
Yeah.
Or should we just leave it for now? And then, because they'll come back with stuff, and I can always do another.
Well, you know what? I think we've got a fair bit of footage.
Yeah, I'm happy.
And then look, and then if we have to come back and just get some little snippets or whatever, we'll do that.
Yeah.
And then we can. I think
That's
we've got
fine.
enough. Though.
What about one thing about how would you summarize what services you offer? So
I think so.
That's not very clear. Just from, I guess
Okay.
Yeah, as a gynecologist,
Okay.
I offer the following services.
These are the common things that
I might do a short and then a short thing on research, because then it kind of gives it validity a bit, I think. Yeah.
Okay.
And then you might have heard about the National Action Plan Like, I won't do a long one. I'll just
No, just roll. We can cut it.
Okay, all right.
Let's roll it out.
Yeah.
Okay. So welcome to the next session, where I'm just going to talk about being a gynecologist and seeing patients with endometriosis, the services that we can offer you, and also some interesting new developments in endometriosis. So you may have seen online there is a new national action plan which the government has allocated some funds for, where I'm involved in this action plan. We plan to come up with a way to help women with endometriosis by doing further research into the condition. The action plan is looking at many centres across at least the eastern seaboard, where we're going to biobank some tissue and look at directed treatments at women with endometriosis. We want to target the adolescents and young adults with pelvic pain, and we also want to help women with infertility and guide them as to the best treatment for their endometriosis. As a gynecologist, the services that I offer are really to look at your condition and to look at your direct needs. So if your issues are pelvic pain, then I can look for management of pelvic pain, whether it be medical management, whether it be putting in an IUD to help you with your period, or whether it be surgery to investigate whether you have endometriosis and remove it, and hopefully that will help your pain. If your issue is infertility, I can do surgery to look for endometriosis and remove it, and this will improve your fertility. Or I also work with Gynecologist, which is an IVF company, and I can help you through an IVF cycle to help you to get pregnant as soon as possible. I hope that this has been helpful for you, and I'd really like to hear from you if you contact me through Wallara Health and Beauty, or send me a post through Facebook or through Instagram.